So before anything else, we need to make sure that we're following COVID-19 protocols such as wearing our mask and sanitizing our hands. So ma'am. Okay ma'am, so good morning. My name is John Katipunan. I'm a physical therapist for today. How are you doing this fine morning ma'am? Okay, so may I ask for your name and age? Okay, so you're 57 years old ma'am, no? So now we can proceed ma'am. So ma'am, for today I'll be assessing sa first your vital signs ma'am so that we can be having a smooth flow na sa ato ang procedure ma'am. So assuming that I have taken the patient's vital signs using the sphygmomanometer, the stethoscope, the watch, and the thermometer, we can now proceed. So ma'am, your heart rate, pulse rate, blood pressure, and temperature are within the normal range ma'am. So we can now proceed to the treatment ma'am because you are in tip-top condition ma'am. Okay ma'am, so it says here sa imong chart ma'am that you came here because left shoulder limitation of movement ma'am, is that right? Okay ma'am, then it is rated 6 out of 10 sa mo ang visual analog pain scale ma'am, no? Okay ma'am, medyo sakit-sakit yun sa ilihok-lihok ma'am, no? So sa mga activities of daily living ma'am, medyo di kayo kakabuhat ma'am. Okay ma'am, so it also stated here ma'am na right radical mastectomy 2 months ago ma'am, is that correct? Okay ma'am, so now ma'am, I'll be assessing for your active range of motion ma'am, no? So I have your goniometer ma'am, which will measure the initial and final testing angles ma'am to determine if with the normal range of or wala. So first ma'am, I want you to raise your arms forward. So from the side ma'am, then towards this forward. Diyan kataman ma'am. Sakit ma'am, ako yung move gamay ma'am. Hindi makaya ma'am, sakit yun. Sige. So next ma'am, kay paside ta ma'am. Sige ma'am. And 3, 2, 1. Diyan kasataman ma'am. Sige ma'am, sige ma'am. Then next ma'am, kay dagita ma'am. Atoy buta to kamot ani position ma'am, then atoy pasaka ma'am palayo mama. Sige ma'am. So in 3, 2, 1. Diya sa kataman ma'am. Sige ma'am. So medyo mubog ito tong measurement sa ato sa ato movement ma'am, no. So ato lang ni sa i-treat so therapy ma'am, improve lagi ni nato ang salig lang mama. Sige ma'am, laban ta ma'am. So for today ma'am, what we'll be performing is that ma'am, we'll be performing a set of peripheral joint mobility techniques ma'am, which will have increase your range of motion ma'am and reduce the stiffness and pain that you will be feeling upon moving ma'am. So with this ma'am, kaya there will be some procedures during this procedure ma'am that I'll be coming in contact with you ma'am, so that be okay ba ma'am? Okay ma'am, so I'll be checking for any contraindications ma'am. So do you have any recent fractures ma'am? Nakay hypermobility ma'am or kanang masubugaan ni mo og panag sa imong joints ma'am? Do you have any inflammation or severe swelling sa imong body ma'am? Ako i-check ma'am, mo hikap po ma'am. Sige, ato to make sure especially sa imong treatment area ma'am. Yes, wala naman ma'am. So, okay ma'am, so you're good to go na ma'am. So can you please lie on your back ma'am? Okay, so ma'am, for today ma'am, we'll be performing 4 sets of kanang treatment, 4 sets of exercises ma'am. And I will be guiding you throughout the process ma'am. So first ma'am, what we'll be performing is a glenohumeral distraction ma'am, wherein it is to increase the mobility of your overall GH joint ma'am, or kaning joint there between your arm and your shoulder ma'am. So what I'll be doing is I want you to place your arm in this position ma'am with 45 degrees of abduction and 30 degrees of horizontal abduction ma'am. I'll be placing my arm lagay sa imong axilla ma'am. Then I'll be placing my one arm here sa underneath sa imong humerus ma'am. So I'll be pulling it pa sidewards mama in 3 counts. Then don't worry ma'am, kay naka-stabilize ni imong trunk and imong scapula ma'am, para dili kay ka mag-move about mama. Sige ma'am, so 3, 2, 1. One more time. 3, 2, 1. Last one. 3, 2, 1. Okay. Sige ma'am. So next ma'am, I'll be performing a posterior glide this time sa imong GH joint ma'am. So what I want you to do is same position gyapon ta ma'am. Then the purpose of this ma'am is in order to increase the range of motion in terms of pag-bend sa imong arms forward mama. So same position ta ma'am, pero this time akong left arm kay naadagay ma'am, I'll be holding it like this, then I'll be pushing it towards the back mama. Sa imong glenohumeral joint. Okay, so 3, 2, 1. Okay, ma'am. So next, ma'am, for this time is I will be performing it sa downward na side, ma'am. So we will be performing a caudal glide of your GH joint this time, ma'am. So same thing yapon, ma'am. I'll be wanting you to do the resting position of your arm, ma'am. So next, ma'am, I'll be placing my arm here. Then I'll be placing my right arm over here, ma'am. Then next, ma'am, I'll be pushing your femoral head downwards, ma'am. Then relax na ta, ma'am. So 3, 2, 1. Okay, ma'am, tayo move further to 90 degrees ma'am, kung asa nang tayo ma'am. Okay ma'am, then ato lang i-move gamay-gamay lang ma'am. So ato lang i-oscillate at grade 2 ma'am. So large amplitude at the range of motion. Okay. Sige, ma'am. So, next, ma'am, kaya I want you to lie prone na sad, ma'am. Before that, ma'am, katong second na itong procedure, ma'am, that was for increasing your capability to raise your arms towards the side, ma'am, since nam sa limitation na, ma'am. So, now, ma'am, I want you to lay on your belly this time, ma'am. Then, ipabitay lang imuhang arm sa edge of the table. So, for this purpose, for video purposes, kaya this is, assuming na nga this is the left arm gapon. So, ma'am, same position gapon ta, ma'am. 45 degrees of abduction and 30 degrees of horizontal reduction. Then, same ko, ma'am, dire. Then, I'll be pushing your femoral head pa forward this time, ma'am, ha? Sige, so, ma'am, 3, 2, 1. Okay, ma'am. Sakit, ma'am. 3, 2, 1. Okay, ma'am. So, you can sit up straight na, ma'am. Okay. So, ma'am, kumusta ang ato ang treatment, ma'am? Okay ata, ma'am? Hindi sakit? Sige, ma'am. So, I'll be taking your vital signs again, ma'am, and assuming that everything is okay. So, ma'am, thank you kaayo for coming to the clinic this time, ma'am. Do you have any more questions, ma'am? Okay, ma'am. So, I hope to see your progress soon, ma'am. And thank you kaayo, ma'am. So, as soon as the patient has left the premises, we can now proceed to disinfect the area. So, we will disinfect the area, disinfect the materials that I have used, such as the vital signs equipment and the goniometer, disinfect our hands, and remove our mask. So, assuming remove na pa ang mask, we can now proceed. So, sir, for the glenohumeral joint, sir, it has a capsular pattern of external rotation, abduction, internal rotation, and flexion, sir. Then, for its resting position, sir, it has a normal range of 40 to 50 degrees of abduction, then 30 degrees of horizontal adduction, sir. Dayon, for the oscillation, sir, I'll be performing it in grade 2 lang, sir, which is large amplitude rhythmic oscillations at the limit lang. So, it will be like this, sir.